So this is the Pec Minor test, and as you can see, we're just letting Sam lay supine, just comfortable, making sure his elbow is flexed to get a true reading of Pec Minor. Because if his elbow is extended, if I extend his elbow, his biceps is going to be put on stretch. So if his elbow is extended, the biceps is going to be put on stretch. Why do we care? Well, the short head of the biceps attaches to the coracoid. So if the biceps is going to play a role in this, if we extend the elbow, it could cause his scapula to anteriorly tilt. So neutral, anterior tilt is going to kind of lift off the table. So for Pec Minor, we want his elbow flexed, because that kind of takes the short head of the biceps out. We want to find his acromion, and we want to see, is it 1 inch away from the table? Now, with this test, this cushion's not ideal. We want like a hard table, because this cushion gives a little bit. So a hard table is the ideal situation you want to be in. But we want to see, is he 1 inch away? Which I'd say he's bigger than 1 inch away, right? That's about 1 inch. He's probably close to 2 inches away. But that's not the whole test. We want to see at rest, and then we want to see if I produce, do you mind if I reach around like this? Okay. If I produce a lateral and superior direction on the acromion, and can I get his acromion to the table? The answer is no. If you can get it to the table without rotation at the thorax or elevation of the thorax, that'd be a normal Pec Minor length. So even if he's like 2 inches, let's say, from the table at rest, but I can bring him passively down without the rotation of the chest, that's going to be a normal Pec Minor length. So just so you can see, when I push down, you can see it's going to rotate a little bit here. I don't know how well you can see that. My hand's kind of in the way here, but as I try to push down, I can't get him to the table. Now, he is extended slightly at the humerus, so I'm going to show you a test that we can do. If I bring him into a neutral position, elbow flexed still, then I can try again. My 2 fingers here are feeling, can I contact the table? I get closer. If I really want to get the biceps out, I can come here, right? And then I can see. So I get pretty close. But most of you are studying a lot, so you're going to have tight Pec Minors, right? Again, remember, this test can be twofold. What we just did here, elbow flexed, Pec Minor. If you want to check the short head of the biceps, just extend the elbow. You can bring them down a little bit here and then see, can I get them down? People with posterior deltoids that are pretty big might limit the point of this test. But the majority of people that you see in the clinic are going to have tight Pec Minors. So just some things to look for.